guy?
I can't move my jaw.
So far, he's okay.
It's our first Halloween-related injury tonight.
Is Dr. on 39 for you?
Is anything hurting right now, Tessa?
This is one of the wilder things you're gonna see.
She'll wake up for this.
Happy Halloween.
Las Vegas is notorious as the nation's pleasure capital.
Most people think Las Vegas, they see the Strip. When you meet people across the country and tell them you're from Las Vegas, they think you live in a hotel and that everybody is a showgirl.
But what few people know is that it's also been voted one of the most livable cities in America. With a booming economy and low taxes, Vegas is a great place to raise a family. It boasts the 5th largest school district in the country. And when the school bell rings, children turn the streets of Las Vegas into their playground. On Halloween, fun and laughter often overflow. Sometimes, trick or treat turns into trauma. That's when the staff in the pediatric emergency room at University Medical Center rise to the occasion. Inside these halls, it's no holiday, as the doctors treat a steady volume of patients.
Pediatric emergency department. So I'm still worried about something going on in his tummy.
I'm Dr. Larry Satkowiak. I'm the director of the Pediatric Emergency Department here at University Medical Center in Las Vegas.
You gotta worry if she bled in her head.
Here at UMC, we'll see about 30,000 patient visits a year.
Ativan or Valium, either one. What do we got handy?
That puts us probably in the top 25% of freestanding pediatric emergency departments.
Give him a second bolus.
We're also the level 1 trauma center for Southern Nevada, part of Arizona, Utah, and California, so we have a large catchment area.
Let's see if we can get you out of this, okay?
So we do see quite a bit of trauma. What's the mechanism of injury?
Patient approximately 35 minutes ago, mother found substance on the side of her mouth.
A mother found her daughter with something in her mouth that was not Halloween candy. Emerald King swallowed a handful of her father's blood pressure pills. The dosage could be deadly.
16 months old, no history, no meds, no allergies. We tried one stick in her right AC. She pulled away. They had a bottle of Klonopin. They're not sure how many she took because the prescription was only for 270. There's about 300 in the bottle.
Oh, I'm Klonopin or Clonidine?
Clonidine, I'm sorry.
Well, we're worried about an ingestion right now because that's the history, and so we're trying to look for those signs. She would be very sleepy. Watch her vital signs, which appear to be normal right now.
I'm Dr. Brandy Kaship, a third-year pediatric resident at UMC Hospital.
Hi.
I'm Dr. Kaship. I'm from LA area, grew up in Long Beach.
You okay? Are you cold?
And then went to college in LA.
You want to tell me what happened?
I love holding babies. The thing that attracted me to Las Vegas and UMC was the fact that you have a very diverse patient population.
Right now, she looks very comfortable.
It's a county hospital, so you see everything. Go take care of the rest of the patients. I've seen things that I've only read about in books, not just once, not just twice, but numerous times.
I'll see you later, okay?
It makes me a better physician.
1-week-old Dayton Robeson is running an unusually high fever.
Hi, I'm Dr. Kaship.
Why did you bring him today?
Turns really red and kind of grunts and stops breathing. And
Does he actually stop breathing?
he just like holds his breath, grunting, you know, like for a few seconds. And
Okay. Has he ever turned blue?
No, just red.
And do you have any other children?
Yeah, he's number 5.
Okay. You have 4 others. Well, I'm gonna take a look at him. Oh, did I scare you? gonna be mad at me, I know. Oh, that's the binky. Where I get you all mad, huh? There we go. When a baby this small has a temperature, need to find out why they have a fever. And the thing we're most worried about is meningitis.
The way they check for meningitis is how?
The way we check for meningitis is to do a spinal tap.
My son was in this hospital a couple years ago, and they would not check for meningitis, and that's what we thought he had. And now you're going to tell him you're going to take the baby?
There's a lot of fears and misconceptions about spinal taps. It's not as if we want to do a lumbar puncture on all children. Parents are particularly concerned that it's going to be extremely painful for the child and that they might suffer paralysis. Let me explain the procedure to you. But really, paralysis is a possibility when we're doing a lumbar puncture in a small child. In a baby, it's unique in that the space, we go between the vertebrae are what make up your spine. We go between that space. And in a baby, when you scrunch them up, that space opens up really well. You can feel it with your
Why can't you just do that? You guys can do the other tests and see if everything's okay, and if not, then, you know, if you can't find anything there, then I can understand that.
I can have you talk to another doctor too, maybe that they can explain it better than I can.
Let's go ahead and just give her 1.2 of Narcan.
It's been 45 minutes since toddler Emerald King was found with pill fragments in her mouth. She's slipping in and out of consciousness.
If the Narcan doesn't wake her back up and get her heart rate back up, I think we'll probably just give her some medicine, put her to sleep, put a tube down, help her breathe, so we can get the tube down her stomach and make it do it safe that way. So she's dropping her heart rate down. When we leave her alone, she does really just kind of go to sleep. So that's really indicative of an ingestion of this type. She is awake and alert enough. We're going to pump her stomach here and see if there are any pill fragments there. And then we'll put down some charcoal, which will absorb anything that happens to be in her gut. Unfortunately, with this type of medication, even one pill can cause a problem with her. 94 over 57.
This is one of the wilder things you're going to see.
Ready?
Gonna wake up.
She'll wake up for this.
There we go. All sorts of pills.
We are seeing some pills coming out, a little bit of white stuff, so it looks like she has gotten some pills down in there. She should do very, very well. There should not be a problem here. They look like candy. It's Halloween, and there's candy all around the house right now, and she found these, spread them out in front of her. She doesn't know that they're not candy.
All right, she's ready to go, guys. Just going to keep her on the monitor, watch her heart rate and her blood pressure, and just let her excrete the medication out of her body.
With her stomach emptied, Emerald is out of danger. She'll be observed overnight in the Peds ICU. Baby Dayton has a high fever and needs a spinal tap to check for meningitis. He could be at risk for a brain infection.
Baby 7 days old.
Resident Kashup consults with attending physician Dr. Reeves.
Mom's not going for the spinal tap. I explained it to her.
So what do you want to do?
I want to do a sepsis workup.
What are we going to do if she refuses outright?
We could either admit the child and start the child on antibiotics and look at how the child is acting, and we can presume meningitis and treat that way.
Well, I mean, the big concern is baby's only 7 days old, and that's a real fever. And this baby, I mean, there's no way we can not treat aggressively with this. All right, well, we'll just go in, we'll educate her a little bit, see if we can change things a little bit in her mind. But if she does outright refuse, kid this age with that fever, we need to get a judge. We don't have a choice. Put him in the hospital and treat him with antibiotics is okay, but you know, that's 21 days of antibiotics. If you want to be by the book by it, and there's no way that's the appropriate thing to do. So we'll talk to mom, see if we can get him in, sir, and I think we'll be okay. Let's go say hello.
A little bit of Irish in my life.
A little bit of headbands, green and bright.
A little bit of shamrocks, wigs and beads.
Party City has everything you see.
And wetness fighters for all-day control. Odor Eater.
Than milk. Silk. Try it today.
Products. Getting started is easy.
Yours. Learn more at naturemade.com. Yeah, we've decided.
Eating out can easily ruin your diet if you make selections that are high in hidden fat.
What I tell patients is when they go to a restaurant, look at how you can defat a diet. Mustard instead of mayonnaise, dressings on the side. Cutting little corners like that add up to many fat grams saved in a day.
For more information on diet and fitness, visit discoveryfitandhealth.com.
I have a very serious job to do because every person that enters these doors is precious cargo. What people fail to realize is this is a business. The Harris way is the best way. My dad is gonna chew you out. Don't you have some checks to write?
Next thing I know, we're at the wrong church.
I know my son is in good hands with you all.
Funeral Boss, series premiere Thursday, March 14th at 10 on Discovery Fit and Health.
Yeah, let's wrap you back up.
Baby Dayton is in the ER to determine the cause of his high fever.
The whole process is pretty stressful. Her baby's only 1 week old, so it's a stressful thing to know that your baby's going through all of this.
So we have already done all the blood and the urine tests.
Sometimes parents need a little bit of time to just sit and take in all the information.
Their immune system's not very strong, and they can catch things really easily.
But it's still very frustrating because you know that this baby really needs to have a lumbar puncture. That's the only way you can be sure he doesn't have meningitis.
Unfortunately, there's no tests or blood tests or anything that we can do to check for that infection other than the spinal fluid test.
So is he going to have to stay in the hospital, or?
Yeah, he should be fine, and I feel pretty comfortable that this is going to turn out just to be a little viral infection, but I'm not 100%, and you wouldn't want me to, make that guess and be wrong.
She was very hesitant, but after having some time to get used to the idea of the spinal tap, now she's agreed to go forth.
Dr. Kasha prepares to do the spinal tap on baby Dayton.
A lot of why the child is upset is the positioning. Small babies hate being forced into position. It's really important to get this fluid. I need to stay calm, I need to stay focused.
Baby Dayton is taken to the intensive care unit while doctors wait for the test results.
Lifeguard 3, that's air.
2 critically ill children head to the UMC pediatric unit at the same time.
This 10-year-old's coming in by flight. And then we have a newborn that's coming in from one of our quick cares. Not breathing well and very cold temperature, 92 degrees. It's not that common that we usually have 2 very critical patients at the same time. Upper page respiratory. Usually we get very fortunate and they get spaced out a little bit. Did somebody go up to meet the helicopter? Okay. We're ready. That's the asthma.
12-year-old Samantha Miles is first to arrive.
Where's respiratory at?
She was at school when her asthma hit.
Ready? 1,
okay.
2, 3.
Samantha can barely breathe.
We're gonna need an x-ray. What's your first name? Samantha. Samantha, you never had to be in the hospital before? No? Just run the fluids. Fluids right open. We're gonna need a blood gas on her too. Just go 2 cc's in there right now. Let's just run that right away. Parents driving down? Yeah. Okay. Okay, sweetie, we're gonna give you some more breathing medicine here. I want you to try and take some slow, deep breaths for me.
Here.
Samantha, I gotta poke your wrist here for some more blood, okay? You get temp on her? She is very ill right now. She's working real hard to breathe. She's wheezing really bad. The concern now is that she may poop out and she may have to be put on a ventilator. Okay, patient number 2.
Next in is 6-week-old Amanda Covey.
She's been fine for you guys? Yeah.
She's behaving strangely and having difficulty breathing.
Mom, what happened today?
She just started acting and looking different than she normally does. She was lethargic. Her limbs weren't, flexing back. She wasn't pinking up. She wasn't right.
Okay. She was a little premature.
Yeah.
We're going to get an IV in her here.
Dr. Setkoviak tries to open baby Amanda's airway with medication.
Yeah, she doesn't sound too good.
If the medication fails, he'll have to intubate.
Try to get a CBC, panel 6 blood sugar. We'll start IV antibiotics, ampicillin and claflin. We'll give her bullets, 20 per kilo. I'll give her about 70 cc's of saline. When two significant critical injuries come in right at the same time, if we can't get the IV in, we need to make things happen. We need to make things happen now. Lives depend on them. Okay, let me try to we'll do a venous stick. This is the reason we have a pediatric emergency department. I need a 22 gauge though. This is the reason we have specially trained doctors and nurses. What's the AccuCheck? 65. We need terbutaline drip for her. Got it, this is good. We got her blood gas back, and she's very ill right now. She's not blowing off her carbon dioxide, and it's very concerning, especially given how fast she's breathing. So our goal right now is to try to keep her airway open, try not to get her to the point of having to intubate her. One of the last things you want to do with a child with asthma is intubate them. Putting them on a ventilator, it makes them very hard to get off. You just keep sitting here. You let me know if there's anything wrong, okay? Linda, who's over here?
I am.
Let's get a second line on her. Samantha's really sick. She's going to have to be in the intensive care unit and try to get her better here.
Okay, Samantha, hold that
She's
arm
wheezing
together.
more, which is good. When she was not wheezing, she wasn't moving air, and that was a real bad sign. So the medicine is working. It's getting in, opening up her breathing tubes. Feeling any better? You Samantha's parents? Yes. Hi, Dr. Setkoviak. Come on right in next to Samantha here. She's opening up her lungs a little bit. We did a blood gas, and she's going to have to be in the intensive care unit overnight at least. So she's pretty bad. She's in the top 1% of bad, I would say, for adolescents.
Okay.
Samantha is in critical condition, but stable. She is sent to the ICU.
I'll probably be the one to give report to on the other job.
Hey there. I'm Karen. I'm one of the nurse practitioners.
I'm Karen Leroy. I'm a pediatric nurse practitioner at University Medical Center in Las Vegas.
What's going on with this guy today?
As a nurse practitioner, you're really doing the medical piece of things. So instead of bringing the patients back, doing my own vital signs, putting in IVs, which are nursing duties.
Slow down, Leah. I'm going to be suturing for a while. Does that hurt? Duh. Why don't we get an x-ray of that? Make sure there's nothing in there. Here, friend, hold real still.
Alan gets an x-ray to see if he broke his foot.
Alan's x-ray is okay, so I can suture him.
He only needs stitches.
I think we're finally going to do this. Can you believe it? You're going to be here a while with me. Alrighty, I spilled my water everywhere. That was good. Now, this first thing I do hurts a little bit.
It doesn't really bug me that I have to inflict pain because I let children know when I have to do something that hurts.
All right, sweetie, that should be it.
Early on in my career, I don't think I was real comfortable with parents being in a room when I did something because I wasn't really good at it.
You did a job on this foot, mister.
At this point in my life, if they're most comfortable watching me suture them, I don't care. I don't care if they're in the room or they're not, as long as they're sitting down and they're safe.
Don't you pass out now.
It's all right.
All right, as long as it's okay, just sit down. I don't take care of big people. Okay. Good. Oh, your foot modeling days may be over, dude. I don't know. Okay. How you feeling? Yeah. It looks good. We're gonna put you on antibiotics though, because I don't know. You need to keep your foot up and stay off it this weekend. You're welcome. Take care.
Alan won't be playing any soccer until his stitches heal completely.
Put your right into.
This is Amanda. She's our little 6-week-old little girl. Her chest x-ray's right here. She has some pneumonia on here that we can see in the right upper lobe, and that's pretty classic with RSV. They get a pneumonia in there, the infection sets in. Part of the lungs close down, and that's the reason she's not breathing so well, and she's needing the extra oxygen. Hello?
Dr. Setkoviak is called back to Amanda. She's in severe distress.
She's not yet. That means she's stopping breathing for a second? Or...
Despite the medications, Amanda's not getting enough oxygen.
Is that okay?
No, not really.
Amanda stops breathing.
Play on.
Voted product of the
Simply Saline. Blend. Visit us on Facebook.
Discovery Fit and Health.
The more speed you need, because
Slows the growth of
I've always wanted to own a funeral.
on a special extra dose of untold stories of the ER.
He fell off a roof and landed on an upright crowbar.
It's killing me.
Okay, let's get you out of the dress and we'll take...
No! I felt something coming out of, like, my rectum.
It was about the thickness of a number 2 pencil. It was kind of flesh-colored, like pig flesh-colored.
Doctor, what's happening?
I don't want to alarm you, but what you're feeling down there in your rectum, it appears to be a...
Untold Stories of the ER, extra dose, Saturday at 9 on Discovery Fit and Health.
I need vecuronium. Well, the RSV has now made her stop breathing.
Baby Amanda is unable to fight the virus. She must be intubated.
She's demonstrated to us that with the medicines we've given her that she can't maintain her own breathing status. And so we're going to give her some medicine to paralyze her, put her to sleep, and then put her on a breathing machine. Come right here.
Okay.
Go ahead. Yeah. The airway lies more anterior in a baby. The airway is much smaller. It's a lot harder to identify the landmarks.
Ready?
I'm ready.
Okay. Gotcha.
Too big. Sick children require a lot of special equipment, a lot of special sizes of equipment as well, and different medications. Where can I go? Gee whiz, she is really tiny. But you have to remember, pediatrics is from age birth to age 18, and that's a wide range of sizes. Boy, she's small. And listen for me, please. 8 at the lips.
She's good.
Good.
With the tube in place, Amanda is finally stable.
Beautiful breath sounds after that.
She's sent to the ICU.
Michelle, what do we do with the rest of the vet?
Dr. Brandy Kashup visits 1-week-old baby Dayton, who was tested for spinal meningitis.
We're gonna go check on our baby from yesterday, who had the sepsis workup, who had the spinal tap, blood cultures, and the urine cultures. We'll see how he's doing.
It's Dayton?
Pediatrics is the most amazing field. I was trying to decide between surgery and pediatrics, and they're sort of the same.
What's the matter,
Because in both you fix things.
You smiling? Are you feeling better today? Are you feeling better today?
He looks really good. Dayton looks wonderful, and fortunately all the test results so far have been negative.
See you tomorrow, Dayton.
So we'll just keep watching him, and we'll keep getting his antibiotics until we have the final results.
The potential is still there that she could end up on a breathing machine. That's why she's here. But the way she's looking right now, it doesn't appear that she's going to anytime soon.
Asthma patient Samantha Miles is slowly recovering in the ICU.
We gave Samantha all the medicines, all the albuterol, the breathing treatments. We opened her up. She got a lot better on the way to the ICU, and now she is in here right now. And she is doing a lot better from where she was upstairs. Her lungs have opened up quite nicely. We're continuing the different medications on her. Things are still looking good. Let's go take a look at Amanda here. So Amanda's now here in the ICU. She's in an Ohio warmer, which allows us to take care of smaller babies a little easier, keep them wide open. This is a heater, actually, to keep her body heat up. She's on the ventilator. So she's doing very well, but she's going to have a lot rockier course than the other patient. Once we put a child on a ventilator, it means things are going to be a little bit more difficult, especially with the RSV. So she will probably have a little bit longer course in the ICU. And it's really going to be kind of a 24, 48-hour thing to reassess her and see how things are going at that point.
Halloween in Las Vegas, when the witches and warlocks emerge and the ghosts and goblins party.
A child who may have appendicitis doubled over in pain will still find the energy to put on their costume and go out and get their candy before they come in.
But it's not just the children having fun. UMC's staff is also under the spell of Halloween madness.
I want to suck your blood.
Audible Strider.
When did this start?
2-year-old Rosario Zapata was at a Halloween party when she started coughing violently and couldn't breathe.
Yesterday.
Yesterday?
Yeah.
And when did it get worse?
Today.
Today? Anybody else have been sick?
Her cousin.
What'll happen is I'll have to pick the phone up and come in.
She looks like she probably has croup, which is a viral infection of her voice box, basically. She's gonna need a racemic treatment.
Okay, big stick.
Okay. She's gotten a dose of steroid, which is decrease that inflammation. But she's also getting some racemic epinephrine, which should help also kind of decrease the inflammation, open up her airway some so she can breathe better. Once she's done breathing that, we'll observe her. They'll probably just blow some cool mist by her face. I'm not certain what she was supposed to be.
Once Rosario is able to breathe better, she can go enjoy the rest of her Halloween.
There you go. That's all.
Before a night of trick-or-treating, a young boy hurt his arm while playing in the yard.
Miss Jake? Hi, Dr. Shakoviak. How are you? Hi, Jake. How'd you break your arm?
I tumbled down an inflatable slide.
Well, what he has done, he's dislocated his elbow. And it's easiest to see it on this x-ray right here. The concern is this piece of bone right here does not belong there. That's a free-floating piece. At his age, his elbow is normally in about four or five different pieces with the growth plates in there. That's probably the medial epicondyle. Normally what happens, if you get the bone put back into place, everything falls back into place. It's not that common that children dislocate their elbow. They usually break it. Right. But it does happen if you catch it just right. So what we're going to do is we're going to bring him in the other room, give him some medicine called Brevitol, which kind of knocks him out for about 4 or 5 minutes, pop the elbow back into place where it needs to be and re-x-ray. So hang on, we'll transfer you over here. I'm waiting for the hep lockish to be placed. It is. Give you a little privacy here. Going trick-or-treating? Yeah? What are you going dressed as?
Psycho.
A psycho? Maybe a psycho with a broken arm and a cast on now, I guess.
You have to be a big kid yourself. You have to be able to go in and get to the child's level.
This isn't looking good for football playoffs, so.
You got children from the age of birth up to the age of 16. You can't use the same personality on all of them.
One of you can sit, because I don't want you both to pass out. If one of you passes out, it's okay. But if you both go, then we're in deep trouble. All right, you're going to be going to sleep in about 15 seconds, okay?
How you doing?
He's not there anymore.
Feeling sleepy?
Just grab him. There it is. That's it.
That's it, guys.
Smooth and gone. Because he's got a lot of swelling on that, so we put a splint on, which will immobilize it just as well as a cast. It's all right.
You're all right, buddy.
It's all right. We're all done, big guy. All right. Now we'll redo the x-rays, and we'll see where everything's lined up at this point, see if that fracture still exists in there. Hey, Jake, how you doing? Open your eyes. We're all done.
Open your eyes, champ.
We're done.
You remember what happened?
Whoa, hey, that's a trip, man.
You know, you're not going anywhere yet.
All right, let's get our x-rays here. Not a thing. It looks like he is lined up completely back. Mr. Jake, you are all set to go. All right, if there's any problems or questions, let us know. Jake, stay out of trouble, have fun trick-or-treating, okay?
Okay.
All right, take care, guys.
Thank you.
Okay.
Dr. Kashyap checks on 1-week-old baby Dayton, whose father has just arrived.
Hi.
How you doing?
Good, how are you? But the mom did the right thing, bringing the child to the hospital.
Looks like he's doing really well.
Doing better if you keep the fever down.
Thankfully, all the tests were negative with Dayton.
The fluid all came back and looked good, so
That's a good thing.
The fever and stuff, I mean, we didn't even know he was sick.
Right. It's nice to see a father involved in his child's life. We don't always see that. It's the best part of my job. There's many sleepless nights when you have a child who's sick. It lives with you, it stays with you, it haunts you, you think about it. You go through the scenario over and over in your mind. You need to make sure that you did the right thing.
The test for spinal meningitis is negative. Baby Dayton can go home.
Bye, guys.
Bye, sweetie. Look at this, you're so cute. You take care. Bye.
I have a very serious job to do because every person that enters these doors is precious cargo. What people fail to realize is this is a business. The Harris way is the best way.
My dad is gonna chew you out.
Don't you have some checks to write?
Next thing I know, we're at the wrong church.
I know my son is in good hands with you all.
Funeral Boss, series premiere Thursday, March 14th at 10 on Discovery Fit and Health.
Now your best accessory can be your smile with Colgate Optic White toothpaste. It whitens over 2 shades more than a leading whitening toothpaste. And try Colgate Optic White mouthwash to whiten more than 3 shades. Use the whole whitening line from Colgate Optic White.
Capella University understands businesses are trying to come back from rough economic times. Employees are being forced to do more with less, and the need for capable leaders is greater than ever. When you see these problems, do you take a step back, or do you want to dive right in? With a degree in business from Capella University, you'll have the knowledge to go further in your career than you ever thought possible. Let's get started at capella.edu.
You're right. That's a 5th floor problem.
Not in my house. No, no, no. Not today.
Jimmy, how happy are folks who save hundreds of dollars switching to Geico?
Happier than Dikembe Mutombo blocking a shot.
Nice.
Get happy. Get Geico. 15 minutes could save you 15% or more.
When you have a Glade Scent and Spray, you're ready for whatever life could bring. Did he catch the early flight home? Will he surprise the kids? We'll see. But with Glade's motion-activated Scent and Spray that offers a hint of Hawaiian breeze, your home is always ready for any surprise. Glade. Open up and invite life in. Automatically fill your home with a welcoming fragrance like Hawaiian breeze.
SC Johnson, a family company.
I'm a pediatric audiologist. I work with little kids, and I was slowing down a little bit. One of my colleagues said, "You're going to run a marathon next year." I've run my 5th 50K, and I ran my first 50-miler, and I'm able to do it because I'm still running healthy, and I attribute that in large part to my Tempur-Pedic. I'm probably healthier at my mid-50s than I was in my mid-40s. It's just become an integral part of my life. My name is Karen Johnson. I'm an ultra-marathon runner, and I'm a Tempur-Pedic owner.
After age 50, women should do strength training exercises. Lifting weights, exercising against resistance. It makes both their bones and muscles stronger. Stretching before your workout may risk injury and actually decrease your strength. New research suggests you should employ stretching after your warm-up or exercise.
To learn more, go to Discovery.
All new Yukon Men, Friday at 9 on Discovery. A deaf child was run over by a car. Dr. Kashup is called to the trauma unit.
Ped versus auto. Full code.
Five-year-old Jose was playing in the street and couldn't hear the car approaching.
Nice deep breath. Abdomen soft.
Whenever you come to a trauma, you just have to stay focused
5 or 6 of Phenergan IV.
5 or 6 come.
and allow one person to direct the resuscitation.
It's 93%.
And follow along so that you're contributing to the resuscitation instead of detracting and confusing people. The fact that Jose is deaf definitely complicates the situation because we have no way of communicating with him. I'm trying to keep the patient calm the best way I know how, which is just by stroking his hair and his hand when I can. That's the only way I know how to communicate with this child, to let him know that we're trying to help him.
One out.
We can't comfort him and explain what we're doing. All he knows is that people are poking at him. He doesn't understand why, and he knows he's in pain, so.
Just have a bigger blood pressure cuff.
Getting ready to put what they call an OG tube in.
He's the same age as my brother. He is the same build as my little brother. This could be my little brother. His heart rate's a little fast. That's probably because he's nervous. He's gone through a lot right now. Whenever you have an emotional response in medicine, you really have to distance yourself from it so it won't affect you.
Do you have some white tape? X-ray? Yeah.
He's going to have his head examined and his belly.
Okay, is CT ready?
Yeah, they're ready right now.
Okay, let's take him. Okay.
Hello.
2-year-old Nagin has a high fever.
Has she peed this morning? Has she urinated? Has she gone pee?
Yes.
She has? How many times? Do you know?
No,
two times? Okay.
Nagin may have a urinary tract infection.
You know what? You're going to need to slip her clothes off. I know she doesn't want to, but leave her shoes on if she wants those on, but at least her shirt. Look at those toes. There are days when it's just but a huge volume of patients. How many layers of clothes do you have on? For the most part, I mean, I hit the floor running at 11, and at 10 o'clock at night I leave. Did she open her mouth for me? Typically, you don't really stop thinking, moving, making decisions for 11 hours. Have you come with me, okay? Well, I'm gonna get a translator for them. What language do you speak?
Persian.
Persian, okay. I need a Persian translator on the phone. I'm the nurse practitioner. I'm the one that does what the doctors do. And I'm wondering a couple of things. Has she urinated today? And does it hurt when she pees? Does he think that he can get her to urinate in a cup? It'll take about an hour after the urine is sent for us to have results back. So they'll be waiting in the room while we wait for the results. Okay? Okay, bye-bye. Give him a urine cup.
On 3, 1, 2, 3.
Jose is now in CAT scan to rule out any internal injuries.
At times it's difficult to detach yourself from the emotions involved in pediatrics. He opens his eyes to painful stimulation, but it's something that you learn as you go through your residency. The CT looks good right now, but we'll need to review it more carefully, but nothing big.
This is an area where you don't have any, you can't evaluate, so just check the pulse.
It's difficult because you are dealing with innocent children, and sometimes the things that they suffer are a result of mistakes that other people have made, and it's frustrating.
Jose will be observed in the ICU for the next 24 hours. Baby Amanda is recovering well from the RSV virus.
Well, it looks like Amanda is out of the peds ICU. She has been transferred out to the pediatric floor, which is a pretty good sign. That's usually a step down. It means she's gotten off the ventilator and she's getting prepared to go home. Here is Amanda right here. She is asleep. But she is looking great. She is a pretty little girl. The virus can cause little babies to stop breathing, and that's always a concern. But at this point, I think Amanda is ready to go home.
Asthma patient Samantha Miles is also doing better. She is able to leave UMC.
Samantha's done well. She's responded exceptionally well to the therapy here in the hospital. She's ready to go home.
All right, let's go.
Asthma is a chronic disease. This can certainly happen again.
Yep, okay, great. Have you come with me, okay? Bring her with Come, yeah.
2-year-old Nagin's urine test results are in.
Be a translator again. I need that Persian translator again, please. Well, her urine came back, and she does have infection in her urine. It's very common for little girls to have fever and nausea and vomiting with urinary tract infections. Okay. If she takes bubble baths at all, I would recommend that she not do that. I think a big piece of it is educating the parents so they know what to do in the future when their child's sick. Does he have any questions for me?
این داروهاشو که میخوام بگیرم
Or they know when to bring the child back if they're not getting better. This is medicine, okay?
Okay.
For the pharmacy.
Thank you.
You're welcome.
Thank you.
Bye-bye. Thank you.
Thank you.
Bye. Take care.
Bye.
Bye-bye.
Bye, Nikki.
I think if you try, the patients that don't speak your language still understand you do care. Thank you. Night, kiddos. This is probably my dream job, actually. I'll see you again on Friday. This is what I know how to do, and I like it.
A 10-year-old boy was riding his bike without a helmet when his tire came off.
This young man who fell, he has a history of having hydrocephalus, which is fluid on the brain, and apparently some bleeding from his ear. So let's see what's going on.
On a special extra dose of untold stories of the ER.
Doctor, what's happening?
What you're feeling down there in your rectum, it appears to be
Untold stories of the ER, extra dose, Saturday at 9 on Discovery Fit and Health.
It just went from a little red spot to bruises in a matter of minutes. I couldn't believe my eyes.
Her skin was literally rotting off of her.
Monsters Inside Me. All new, Monday at 10 on Discovery Fit and Health.
When allergy congestion hits, I rely on the
Mom's secret.
Who wants some popcorn
and a smooth side?
You don't decide when vegetables.
The sensitivity is taken care of.
Or a stepper, or an elliptical.
Line for your free info kit to see weight loss program. You've hit a plateau.
The very first few weeks on a diet, you lose weight very rapidly. As you approach your target weight, your body will lose weight more slowly as it adapts to what should be your real body weight. So if you've reached a plateau, reevaluate your exercise, reevaluate your diet, and then you'll break through that plateau.
For more information, visit discoveryfitandhealth.com.
I have a very serious job to do because every person that enters these doors is precious cargo. What people fail to realize is this is a business. The Harris way is the best way. My dad is gonna chew you out. Don't you have some checks to write?
Next thing I know, we're at the wrong church.
I know my son is in good hands with you all.
Funeral Boss, series premiere Thursday, March 14th at 10 on Discovery Fit and Health.
Hey, Christian, Dr. Satkoviak.
Can you help my jaw and my ear?
Well, yeah, what happened, big guy?
10-year-old Christian Williams hit his head hard on the pavement when he fell off his bike.
Look here, okay? Let me see your eyes. Is your head hurt?
I think all healthcare professionals either like to do pediatrics or don't like to do pediatrics.
What happened to them?
You go talk to nurses or doctors who are taking care of adults and they say, I just don't like to see sick children.
I know. All right.
I think those of us who go into pediatrics look at it really from the fact of, I don't like to see children sick and crying. I like to make them better.
You got your chin too, huh?
Yeah.
All right, open your mouth for me real big. Big ah.
It hurts.
It hurts when you try to open? Yeah. Okay, do you have a helmet on?
No.
Oh, man. We gotta get you a helmet, don't we? Oh, we're gonna have to do a CAT scan, okay? You've had those 100 times, I bet, haven't you?
Yeah. Mama, please tell him to do my ear, my jaw, please.
Okay, CT head without. Okay. Thank you. I'm worried about his jaw, too. It's not unusual you fall down, hit here, and you can break the jaw up there. But that's a secondary problem. We always worry about when there's blood coming from the ear that there's a fracture at the base of the skull back here. That can be a sign. Okay. All right, big guy, you hang tight here.
I love my mama to death. Anything I do, she rushes me to the hospital.
Christian goes for a CAT scan to check for any possible brain injury.
Okay, come on, let's go. This young man is 10 years old. He has a history of having hydrocephalus.
Not gonna hurt, all right?
And they end up having a tube or a shunt placed in their brain. The shunt is actually the tubing goes from there, he's got another tube from there, and then that tube goes down through the neck, travels down into the abdomen. They can have problems with that shunt, but it does set them up for when they have a head injury to have other types of injuries with that as well. We're doing right now, we're looking specifically at the bones to make sure there's no fracture there, and we're trying to determine that right now, but I don't see anything else at this point. It's going to require intervention.
The CT shows no brain damage.
I'm right back in this chair.
Next, he's sent to X-ray to see if his jaw is broken.
And hold very still now. Okay. Well, he does have a fracture at the top of the jawbone on the left side. It looks a lot different than the other side, but it's lined up pretty well. I think he'll do very well with that fracture. Right up here is where the fracture is. CAT scan looks fine. They don't see anything on there. I always worry with that blood coming out that there is a fracture we're missing. We're going to admit him overnight to watch him. We'll have the oral surgeon see him, and I'm going to stitch up his chin.
You doing it?
I did it. Stuck the needle right through you. Last one. 12 of them. Lucky I didn't put one more in, and that would have been bad luck, huh?
My jaw broke.
Hey, hi. How's he doing?
He's doing real well.
5-year-old Jose Medina, who was hit by a car, has made a remarkable recovery.
Children are extremely resilient and recover very quickly from injuries.
You gonna talk to me?
There's no way if I was injured like some of these children that I would have such a quick recovery.
You feeling better?
These types of injuries offer a lot of satisfaction because they're so severe when they come in, almost shocking to most people who see them. And when the child leaves, they look completely repaired. So it offers you a lot of satisfaction that you've done the child a lot of good. A day in a resident's life. And why'd you bring her today? It can be exciting or not exciting.
Is this kid going upstairs?
So it's pretty demanding, but most of the time you're running around a lot. It's hard to imagine working so hard. I'm gonna go talk to the parents, but it's exciting, it's fun. 2 meses, más o menos. Residency definitely affects my social life. Because you have less time to spend with your friends. But I am happy. I love what I do. I wouldn't do anything else in the world. Dr. Cassim, how are you?
We are going down to the ICU to see Christian Williams, who's going to be discharged shortly. We have been provided both bicycle helmets and car seats. Child comes in with an injury, doesn't have a bicycle helmet. Let's send him home on one. It's a time to teach. Christian, how are you?
Hi, how you doing?
Doing okay now? How's your jaw? Still hurting?
Yeah.
Yeah, but I guess you're not going to do anything, huh?
No.
That's good news. I know you didn't want your jaw wired shut.
Maybe a week.
Maybe a week? And then what?
And then I'm gonna ride my bike again.
And when you ride your bike next time, what are you going to be wearing?
A helmet and some knee pads.
All right, you get that protective gear on there, okay?
Yes.
All right, good. I got 2 helmets for you to choose from. This one's kind of a dark gray helmet. This one comes with a bike lock and sunglasses.
Okay, I want that one.
I figured that would be the one you want, so you'd get the more things. Now, you got to promise me you're going to wear this every time you're on that bike.
Okay.
Because we don't want you back in here. Big guy.
Thank you.
All right, man. You stay out of trouble.
Uh-huh.
Be safe.
Okay.
All right, I don't want to have to see you back, okay?
Thank you.
All right, man. Talk to you later. Good luck.
Nice.
As a doctor, it becomes such a dream over such a long period, you can't imagine yourself doing anything else. You've dreamed about it for so long, and you work to that goal, and when you get there, it's like there was never another choice. Most people say you can't be a good pediatrician unless you have your own children. Having children helps you empathize with parents.
And until you've had your own child and you know what they're saying, you really can't relate to that. How was school, guys?
Great.
Good.
Ouch.
Any trouble today at school?